Well, I'm expecting it to change my life currently because of what I'm experiencing, and I'm hoping this can be a benefit. I'm interested in having my smile back so that I can feel better about myself. It's a step in the right direction to getting my life back and feeling happy again and not being insecure, to be honest with you. I want my happiness again, I want my smile, I want my confidence, and I want to be healthy. Hi, my name is Christine Membrano, and I currently reside in East Harlem, New York, and I am currently 38 years old. I think that's gonna be one of the best moments in my life because it's something that I've been waiting for. And now that the day is finally coming, I think it's gonna be a major relief for me. It's been about a year and a half that I've been researching, and thank goodness for my aunt that recommended me to Jose after she did her research. She's been researching for almost 2 years, and we found Jose. Because through experience from other people and advice, people, they did mention to go other places, and when I did my research, I felt like it didn't work for me until I found this location. And with the experience and all the knowledge that Dr. Jose and his team have, I felt like it would be a better fit for myself. I really am excited. I'm nervous, I'm excited, I'm all in one. I know it's gonna happen, and I think that's what is making me, really happy about it.
It's normal to be scared, but just let it go. You are here, and your life is gonna change today, okay?
Yes, that's the goal. Thank you, and I appreciate you.
That's the idea.
Everybody here, God is with us, and
Exactly.
gonna make sure everything's gonna go good.
God will be back. Hi, I'm Dr. José Moguel. I have been a dentist for almost 38 years now, and I've placed more than 18,000 implants in my career. I am one of the most international experienced dentists in Mexico.
Dr. José Moguel, why do you think the Trillion 8 is a better treatment than the usually all-on-4 or even the Trillion 6?
Yeah, that's very easy to understand. More implants we place in the mouth, more support we have for the bite, less stress we apply on those implants, and that means that this implant will last longer time in the mouth of the patient. That also gives us the chance to do thinner teeth, like more natural shape, and then after that, if you have some damage in one implant, wherever, or one crown, you just take out this little bridge and not the full arch, as in the other treatments you mentioned it. So that's the most important thing about the Trillion 8.
It was amazing. It was something that I wasn't offered anywhere else, especially with the traveling and the all-inclusive. All that would have been separate. So to get great quality in the implants and then the traveling and all of that, it made it a lot more easier for me, and which was great, and within a certain budget. So that was the A1. I feel like when you do your research and you try to find out, you need to find out what's going to be more beneficial for you as far as traveling, as far as maintenance, and being able to contact a lot of places when you go outside, like to Turkey and other, it's hard for you to travel back and forth. So you want to find something that's a little bit, within reach if you're from the United States. I felt like Mexico was probably the closest, but they did offer better services in my opinion. So my opinion would be going out of state if you can't afford it within the States, and even affording it within the States, they don't do the best job. So you want to go where they're going to offer you the best job. It's not always about the price, but it's about the quality. I had a surgery, the gastric bypass.
Yes.
In 2022, that was about it.
Okay, they didn't give you some vitamins or supplements for that?
Multivitamins.
Multivitamins, okay. So do you smoke?
I used to, I stopped.
Yeah, okay. When did you quit?
It's been about a month now.
The procedure, okay. But you will be able to follow some orders, like open wide your mouth or move your head from the side to side. Not that much, because we are using a twilight sedation, but you won't be in pain, don't worry, okay? We do this every day with every patient, and even more nervous than you about it. You will feel very relaxed and even very sleepy. You will be under during some parts of the surgery, like when they need to numb you, you will be totally under, okay? So don't worry, just trust us. Everything's gonna be okay. I mean, it's not general anesthesia, okay? It's just a sedation, okay? Hello, I am Dr. Febe Morales. I am the anesthesiologist from Dr. José Moguel, and we've been working as a team with the IV sedation so that the patients feel more comfortable and safe during the surgery.
How does the IV sedation help them feel calm and comfortable during the procedure?
Okay, I think an important part of the process is the communication. So I explain them very well how the surgery will be and how the sedation will work with them. So they won't remember anything at the end of the procedure, but they will able to follow some orders and feel very, very calm and even sleepy during the procedure so that they won't feel any kind of pain. The only thing that they can feel is pressure. It's just that, and it's normal.
What problems have you seen looking for the treatments like the all-on-4? Like, because you already say it's less implants. What is the problem when you see some patient coming for all-on-4? They went to Turkey or Colombia and they come here to the clinic to restore that implant restoration.
Sure. That also happened with the all-on-4 men in USA. So the same, but in the opposite. This less implant you have, more stress you apply on the implants, and then those implants will last less time in the mouth. And as I said, if you lose one implant or one crown, you need to take out all the bridge. So that becomes more expensive and complicated for the patients and the doctors.
So, doctor, why do you think the dental tourism is a really good solution for patients that are looking for a dental implant international treatment?
Well, the good thing about the dental tourism is the prices. We have very good dentists in Mexico, so we can get very, very good dentists in USA, in Colombia, in Turkey, wherever. But the fact to be here in Los Algodones, in the border with Yuma, Arizona, we are pretty close for a lot of patients from California, Oregon, and of course all Arizona. And then the prices are really, really low for them. So that gives the patient the possibility to get a very, very good treatment that they would never be able to pay in America.
Do you know approximately how much they try to charge in the United States for a full mouth restoration?
Yes, about 48 to 50,000. That was a lot. That was gonna take me a very long time to save up and do it. I was determined at one point, but when I reached out for other sources, and then when my aunt helped me reach out for this source, in comparison, this offered the best quality over quantity. And that's what I was looking for. It didn't really matter about the price because I was willing, but I got the best price and I got the best quality, so that's what I went for.
Yeah.
It was amazing. It was something that I wasn't offered anywhere else, especially with the traveling and the all-inclusive. All that would have been separate. So to get great quality in the implants and then the traveling and all of that, it made it a lot more easier for me, and which was great, and within a certain budget. So that was the A1.
All right. From your medical experience, why do you think so many patients from the United States chose to come to Mexico for their dental implant treatment?
I think we have three mainly reasons. The first one is that we are close to the US border. The second one is that we use the top technology. And the third one is we are more affordable than any other country, even US and Canada.
Well, I'm expecting it to change my life currently because of what I'm experiencing, and I'm hoping this can be a benefit. I'm interested in having my smile back so that I can feel better about myself. It's a step in the right direction to getting my life back and feeling happy again and not being insecure, to be honest with you. I want my happiness again, I want my smile, I want my confidence, and I want to be healthy. The most important is to be healthy and to have a healthy mouth.
Why do you believe this type of treatment is not only dental, but also deeply emotional for many patients?
Okay, I think because it is an opportunity so the patient can improve their quality of life, become more confident, and even the treatments helps them with simply activities such as biting or smile even, so they feel so much better and happier at the end of the procedures.
What is mean for you restore a smile and a life in personal level?
Well, after thousands of lives changed, as you say, that gives me a very high personal satisfaction, because this is a life-changing experience really for most of the patients. Many patients has passed all her life or their life trying to get a nice smile, and they haven't get it because it's too expensive, because they didn't have time or money or the proper dentist, etc. So after what the patient says, it's very important to recover their self-esteem, which is very important. You know, when you have a periodontal disease in very bad shape, you cannot smile, you don't like to the people to see you smiling, or you cannot eat, or you cannot get a personal relationship because it's bad. So people really appreciate it, and after this treatment, the T&A especially, they are very grateful with me and the life.